All right. Hi. Look, I've been approached by quite a few of my colleagues in the medical profession around the management of impaired doctors. Yeah. As you can imagine, when doctors have health challenges and they receive a notification from AHPRA, it can compound their stressors, and it can certainly lead to a deterioration in their mental health status. I think in the past, AHPRA hasn't quite struck the right balance with respect to maintaining patient safety, but also empathetically managing doctors who are, of course, highly skilled, highly trained, entirely devoted to their profession and going through a really tough period, which is also incredibly stigmatising for them in the profession. So I'm interested to know what kind of reforms AHPRA is undertaking and collaborative efforts it is doing both with the profession as well as with the relevant state and subnational agencies. Thank you.
Thanks for your question, Senator. Justin Unstone, CEO of AHPRA. You're absolutely right. I took over as CEO of AHPRA just over 12 months ago. But certainly there had been reports, long-standing reports, feedback of practitioners who would have negative experiences within our regulatory system. And obviously paramount responsibility in the legislation is public protection, but we also have to ensure that we are supporting the practitioners who are going through the system. Some expert advisory group was stood up in 2023, which included people with lived experience, so practitioners who had had a negative experience in our system, as well as international experts and Australian experts as well, to look at this issue holistically. Through that, a report was commissioned, which provided 15 recommendations and 33 actions. We have a dedicated workforce and team that has been working with the expert advisory group to implement those recommendations. We've made really strong and positive progress. Examples of the kind of work that we've been doing: we now have a triage process, which means that when we are dealing with a practitioner that has some level of impairment, that we off-ramp them off the standard processes. We have a dedicated team that take a trauma-informed approach to working with those practitioners. And again, we're focusing on limiting the regulatory action and really trying to support that practitioner to get back to full health, to be able to get back into practice. So that's been extremely successful. We've undertaken large-scale training across the whole organisation and all decision-makers when it comes to mental health and substance abuse as well. We've also looked at other issues such as we certainly had heard feedback that there was a requirement sometimes for a practitioner who presented with impairment that was creating performance issues to have to get an independent assessment from a practitioner. But often what they wanted was to continue to get that assessment from their own practitioner. So we've now changed our approach to adopt that as well. And then there's a range of other activities that we continue to implement as well. I think we've made a really significant change in the system. We're also doing a lot of education for practitioners. To your point, I've met with practitioners who tell me they've spent many years studying, both through the university sector and then through their specialty training. And to have a complaint made can create a lot of stigma for them. It can create an identity crisis. And so, again, we're aware of that, so we're doing a lot of education with the profession at the moment to destigmatise the process and to really provide clarity about what they can expect when they come to us. So I'm quite proud of what the organisation has achieved. I think it's quite significant, but I also acknowledge there's always more to be done, and we'll continue to really focus on making sure we get that balance right between patients and practitioners.
Thank you. Just last, with follow-up, with your report, how many recommendations have been implemented and how many are still outstanding?
Yeah, sure. I'll just check.
You can take it on notice.
Yeah, I might take that on notice.
Sure.
From memory, we have completed the substantial number of those recommendations. There are only a few outstanding, but there is progress in all of those recommendations. So they are all due to be closed over the next 12 months. And
is the report on your website?
It is, yes. Okay. It's public, and we provide updates on our website for transparency purposes too.
Thank you very much.
Thank you.
Great. We'll go to Senator Pocock.